Hey everybody, hope you're doing well. Let me just explain first off that the reason my hair is flowing is not because I'm trying to look like a model. I'm literally sitting in front of a fan, which is what I do 24/7 in the months of April and May here in Oaxaca, Mexico, because we don't have air conditioning. So I'm not trying to be, I'm just trying to survive. So anyway, all I wanted to talk about real quick was we've lived here 2.5 years and I still have culture shock over one thing. That is the incredible ease with which you can get healthcare here. So I literally just texted my doctor. I texted her. She answered. I said, hey, I'm feeling kind of blah lately. Tired. I've got my eczema's flaring back up. I've felt dizzy a couple times the past week. I'm just hoping everything's okay. You know, what do you suggest? And she said, I'll send a nurse by your house Thursday morning to do blood work. And I'll get the results, and the next day we'll meet and talk about it. I literally texted her. She answered. She didn't charge me anything. She's sending a nurse to my house to do blood work. And then I'm going to go meet her, and we'll talk about it. And I'll end up paying 1/10 of what I would pay in the U.S. And I saved how many hours of waiting and paperwork and insurance stuff. We don't do that here. We don't do that here. I'm just always in shock at how the doctors here give you their phone numbers. They want you to call them, text them. And you know, they charge so little. And I know people might think, well, yeah, because the cost of living in Mexico is lower. Well, yeah, kinda, but actually it's not proportional what they charge for healthcare here. If you go to a pharmacy here, there's usually a doctor in a pharmacy. Like if you just have like congestion or an upset stomach or something that's not, you know, a huge deal, you're gonna pay roughly $3 to see that doctor. So that is not equivalent to the hundreds you would pay if you don't have insurance. Even with insurance, you pay hundreds a month and then your copay. That's nothing compared to the hundreds you would pay to see a doctor in the US. Your average person here will go see a doctor. They can afford to see a doctor. Even the poorest people here, they typically have a way to see a doctor for, you know, just your everyday sicknesses. But in the US, I mean, it was just normal for me and my friends and my coworkers to be like, oh, I feel so terrible. I need to go see a doctor, but I don't have the money. So anyway, they're just so simple here. You just walk into the office. There's not a secretary. There's just the doctor, and that's it. Now, if you go to a bigger place, of course, you're going to have like a secretary and things like that. But typically, the doctors here are small, private practices, and they charge what they want to charge. And if it's too much, you just go somewhere else. So my doctor typically charges between $15 and $20 for a visit. Yeah, I'm just still in shock that I can take care of myself because I live here, because it's so affordable. Also, you don't need prescriptions for a bunch of stuff. I just walk in and get my anti-anxiety medicine over the counter. If my back is flaring up and it's really tight and I want a muscle relaxer, I walk into the pharmacy and I get a muscle relaxer. So I understand there needs to be, you know, certain regulations and rules over certain medicines, but overall, the American healthcare system is designed to milk people as much as possible and to make as much money as possible off of them. Here, your doctors sit across from you, they look you in the eye, they go over things with you for an hour. In America, you get about 20 seconds max to state what's going on with yourself, and then they're gonna prescribe something and charge you an arm and a leg. I'm still, 2.5 years later, I'm still in shock at how easy it is for me to get what I need here. I can't deal with the American healthcare system. We went to America for Christmas and I ran out of my anti-anxiety medicines because we ended up staying longer than we thought. So I brought them with me. It's Cymbalta, by the way. And it was so hard to get in the United States. I'm thankful to work for an amazing organization. They helped me get it, but otherwise I could not have gotten that medicine without the help of my organization. The doctor in our organization got those medicines for me. Otherwise, if I had not been with this company that I work for, I really would have been just up a creek without a paddle. I could not have gotten them. It would have been months potentially before I could get my anti-anxiety medicine. I don't understand that. So anyway, I'm still in culture shock at just how easy it is for me to get what I need. I feel like it's wonderful.